Okay, good day everyone. Our topic for today is about mechanical ventilation. So what is mechanical ventilation? So this is a respiratory support for patients requiring an artificial airway. So this only supports patients in terms of oxygenation and ventilation. Ibig sabihin, this does not cure, treat, or address any respiratory problems or respiratory disorders, but it only provides support. Okay, and this requires an artificial airway. So what are these artificial airways? Commonly, you have your ET tube or your endotracheal tube and your tracheostomy. Okay, so these are the common airways that are used for mechanical ventilation. So when do we use mechanical ventilation? Ano ang indications for getting mechanical ventilation? So generally, bakit ba nagkakaroon or nako-connect sa mech vent ang isang pasyente? So this is done if a patient has problems with their ventilation and their oxygenation. If a patient is not able to spontaneously or independently ventilate properly. Ibig sabihin, yung pasyente, hindi nila kayang i-sustain mismo ng sila lang, ng sarili lang nila yung kanilang ventilation or yung kanilang paghinga, resulting to problems with oxygenation. Okay, so what are examples of patients that have problems with ventilation and oxygenation? Okay, we have examples. Number 1, patients with respiratory failure. Okay, respiratory failure. What else? Patients with ARDS. Patients with either bradypnea or apnea with respiratory arrest. Okay? Arrest. Okay? Patients with bradypnea or apnea with respiratory arrest. So what is the difference between bradypnea and apnea? So pag sinabi natin bradypnea, this is, ano bang normal na amount ng respiratory rate natin? It should be 12 to 20 or 16 to 20 breaths per minute. But when you say bradypnea, these patients have less than 12 cycles or 12 breaths per minute. Okay, pag sinabi naman natin apnea, this is the absence of breathing. What else? Patients with neuromuscular problems. Okay, neuromuscular problems. These are patients that have problems with their nerves that are controlling their muscles or may problema sila sa mismong muscle na nag-i-aid or tumutulong sa kanilang ventilation. Like what? For example, pag nagkaroon ng paralysis ng diaphragm or nagka-problema sa diaphragm or the nerve that controls the diaphragm kaya hindi nakakapag-breathe ng tama ang pasyente. So pwede silang ma-mech vent. What else? Patients who have decreased levels of consciousness or are unconscious and cannot control their own breathing. Okay, what else? Patients who have undergone major surgeries, especially if they have been under general anesthesia. What else? Respiratory muscle fatigue. Okay, pag yung mismong muscles natin for respiration, mapagod na sila. Okay, so the muscles for respiration. So these are the common indications for the use of mech vent. So what are the components that we have to remember when it comes to mechanical ventilation? Number 1, we have tidal volume. Okay, pag sinabi natin tidal volume, this is the amount of air. Okay, amount of air or gas that is delivered with each breath. Ito yung total amount of air na binibigay ng mechanical ventilator sa pasyente with each breath. Next, you have respiratory rate. Of course, this refers to the number of breaths. Okay, kung ilang beses dinedeliver ang hangin kay patient. And then, lastly, we have FiO2 or fraction of inspired oxygen. So this is the concentration of oxygen dun sa gas na dinedeliver kay patient. So for example, sa tidal volume natin, that's the total amount of air that we give to the patient. But yung FiO2 is yung amount or concentration ng oxygen na nandun sa air na dinedeliver kay patient. This is usually titrated from 20 to 100%. Okay, that's your FiO2. By the way, everyone, mechanical ventilator can either be total or partial. Okay, pag sinabi nating total, yung mechanical ventilator, parang siya na mismo yung humihinga para sa pasyente. But when we say partial, okay, this still allows, okay, the patient's ability to breathe in between or to breathe spontaneously, but with the help of mechanical ventilator depending upon the settings na isa-set dun sa mech vent, which will be discussed later. Okay, so you have tidal volume, respiratory rate, and FiO2. By the way guys, yung mechanical ventilator, okay, for example, this is a mech vent. Before it goes to the patient, nagbabypass siya sa isang machine referred to as HMB. This HMB, okay, or tinatawag nating, as far as I know, this is humidified or humidity and moisture balance. Parang ganun yung meaning niya. HMB, I'm not sure. Kindly refer to your books for it. But, ang responsibility niyan is to humidify the air, okay, that is delivered from the mech vent bago siya pumasok kay patient because oxygen is dry gas. And dry gas can, okay, irritate respiratory tissues, pwede magkaroon ng trauma or generally irritation sa mismong respiratory tract ng patient. And again, gumagamit tayo ng artificial airway. Ibig sabihin, binabypass or hindi na dumadaan yung hangin na yon sa upper part ng respiratory system, particularly sa nose at sa nasal cavity. So, hindi na nahihumidify ng mismong katawan yung hangin. That's why, before pumasok sa mismong katawan ng pasyente yung hangin, this is first, okay, passes through this HMB machine to humidify that air bago siya i-deliver sa loob ng katawan ng pasyente. So, what are the different ventilation modes? Okay, yung mga common mode natin, we have number 1, assist control. Okay, assist control or AC. Assist control, okay, the ventilator delivers full breaths at a set rate. Okay, ibig sabihin, nakaset yung rate, okay, ng breaths na i-deliver kay patient. But, the patient can still trigger additional breaths. Ibig sabihin, yung mech vent, magbibigay siya ng hangin dun sa nakaset na rate sa kanya. But, it still allows the patient to trigger, okay, additional breaths kapag kailangan. That's assist control. Next, you have synchronized intermittent mandatory ventilation or SIMV. Okay, in SIMV, the machine delivers set breaths but allows the patient to take spontaneous breaths in between. Ibig sabihin, may nakaset din. Okay, meron din nakaset na rate ng breaths na i-deliver kay patient but the machine allows the patient to, okay, have spontaneous breaths in between. Sa pagitan ng mga nakaset, okay, na breath ni patient is or dun sa nakaset na breath na i-deliver ng machine, pwedeng huminga si patient on their own. Okay, that's SIMV. And then you have PSV or pressure support ventilation. Okay, in here, pressure support ventilation. Baliktad yung pagkasulat ko. Pressure support ventilation. Okay, from here, it only supports the spontaneous breaths of the patient. Ibig sabihin, yung patient ang humihinga but the machine supports or provides pressure dun sa spontaneous breaths ni patient. Okay, so si patient humihinga siya. The machine is only providing support to the patient. Okay, PSV, pressure support ventilation. So ito yung mga common, okay, na settings for ventilator. You have assist control, synchronized intermittent mandatory or SIMV, and PSV. There are other still settings pero ito yung mga commonly used na, okay, ventilator settings. Now, there are two types of pressure delivered by a mech vent. Number 1, you have positive pressure. And next is negative pressure. Okay, the positive pressure, this allows for lung expansion. Okay, na-discuss yan as isang example under this is the PEEP or positive and expiratory pressure. And then next, you have negative pressure. So, yung negative pressure, dinedeliver yan sa lungs. Okay? So, kapag the more na nagiging negative yung pressure sa loob ng lungs at mas mataas ang pressure sa atmosphere, that will draw air from the atmosphere into the patient's lungs. Okay? So, yun si positive pressure for lung expansion and then negative pressure to draw more air from the atmosphere. So, yan si mechanical ventilator. Now, what are the complications of mechanical ventilator? Complications. Okay. Number 1, you have ang pinaka-common ventilator acquired pneumonia. Ventilator-acquired pneumonia. Especially, usually kasi yung mga patients natin na on Mech vent, they are bedridden. So, nagkakaroon sila ng problem with ventilation and they are more prone to developing infections. Of course, kasi hindi nila ma-provide sa sarili nila yung oral hygiene. And of course, hindi sila nakakapag-excrete on their own ng kanilang mga, for example, if they have phlegm or if they have secretions. Okay? So, ventilator-acquired pneumonia. How do we prevent ventilator-acquired pneumonia? Next, first, we have to raise head of bed. For semi-foulers dapat to, 30 to 45 degrees. Okay, you have semi-foulers. Okay, raise head of bed 30 to 45 degrees. We have to have suctioning. Okay, scheduled suctioning, especially if the patient has secretions. What else? Providing oral care to the patient. Providing oral care or oral hygiene to the patient, especially if they are not able to independently provide care for themselves. And then, of course, you have to be hygienic. Hand hygiene. Okay, as healthcare providers handling the patients, and of course, we have to minimize as much as possible. Okay? Tube disconnections. Kasi the more na nadi-disconnect, okay, the more or the higher the risk, okay, na makakuha ng microorganisms from the environment. And these microorganisms can cause infection. Number 2, we have hemodynamic compromise. Pag sinabi nating hemodynamic compromise, nagkakaroon ng problema sa circulation ng pasyente. Okay, it becomes a problem with the patient's circulation. Paano? Because under normal circumstances, yung intra, di ba, I've mentioned it already earlier, okay, na yung pressure, okay, between or inside the intrapleural space or the intrathoracic cavity is negative pressure. Okay, ngayon, yung negative pressure na yon, it helps in oxygen, okay, exchange, gas exchange, especially in venous return. Okay, nakakatulong sa venous return yung negative pressure na yon. Now, if we have patients, okay, na nagde-deliver tayo sa kanila ng positive pressure, negative pressure nga yung ginagamit natin for venous return, pag binigyan sila ng positive pressure, pwedeng magkaroon ng problema sa kanilang venous return, sa kanilang blood circulation. So, for patients with hemodynamic or okay, for patients who are at risk for developing hemodynamic compromise, who always have to monitor their vital signs, especially yung kanilang blood pressure, mga kanilang pulse rate. Okay, we have to monitor their vital signs for patients who are at risk for developing hemodynamic pressure. Lastly, we have barotrauma. When we say barotrauma, this is when the alveoli ruptures. If masyadong mataas yung concentration or masyadong mataas yung pressure na dinedeliver natin sa alveoli, this can cause that alveoli to rupture. Okay, so that is barotrauma. Now, we have to talk about, okay, care, okay, for mechanical ventilator. So, for caring for mechanical ventilator, we have to remember there are 2 types of alarms under mechanical ventilator. You have high and low pressure alarm. So, these are the 2 types of alarms when caring for mechanical ventilator. First, high. Okay, ano kaya ang rason kung bakit nagkakaroon ng high pressure alarm? So, this is when there is increased resistance. Excuse me. Increased resistance, 'di ba? Lagi nating example when it comes to pressure, okay? Kapag mas makipot yung daanan, mas mataas ang pressure. Okay? So, ang tandaan lang ninyo, kapag high pressure alarm ang tumunog, possible na merong increased resistance, merong bumabara or umiipit sa tubo. Okay? Kasi ang tandaan, pag mas makipot, okay, ang daanan or ang tubo, mas mataas ang pressure. So what are the examples of things or instances that can cause high pressure alarm? For example, pag merong nakabara, obstructions, sumisikip ang daanan. What else? Kinking. Okay, pag naipit yung tubo or umikot yung tubo, okay, pwedeng sumikip yung daanan. This can cause increased pressure. Okay, pag low naman, okay, there is decreased resistance. Okay, mababa ang pressure sa loob ng tubo. What are the most common causes of low pressure alarm? Pwedeng air leak. Okay? Kasi, instead na yung pressure nasa loob lang ng tubo, okay, lumalabas siya sa tubo. Kaya bumababa yung pressure sa loob ng tubo. What else? Disconnection. Pwedeng disconnection. So, there are two types of alarms. You have high pressure alarm, okay, and then you have low pressure alarm. Okay, now, let's talk about ventilator weaning. Ventilator weaning. Pag sinabi nating ventilator weaning, this is the process, okay, of assessing and performing trials, okay, before we disconnect the patient from mechanical ventilator. Yung weaning, this is a gradual removal of respiratory support from the patient. Okay? Gradual removal of ventilator support to the patient. Okay, dahan-dahan nating, okay, tinatanggal or dinidecrease yung support from the mechanical ventilator to allow the patient to resume independent breathing. Okay, para bumalik or ma-promote natin yung ability ng pasyente na huminga on their own. So, ano ba ang ginagawa natin for ventilator weaning? Okay, of course, number one, we have to assess for patient's readiness. Assess for readiness. Ready na ba ang pasyente na matanggalan ng mechanical ventilator? So, dito, tinitignan natin kung si patient ba is stable already? Are they stabilized already? Meron na ba silang ability to breathe spontaneously? So, that is assessing patient's readiness. So, every time ba na nagde-decrease tayo ng support or when we do our trials, okay, kaya ba nilang i-sustain? Hindi ba nagkakaroon ng drop sa kanilang, for example, SpO2 or ang kanilang oxygen saturation? Hindi ba biglang bumababa? Okay, hindi ba sila nagkakaroon ng signs of difficulty of breathing? Hindi ba sila nagtatakipnea? Can they sustain spontaneous or independent breathing? Yun po si assessing of readiness. Number 2, ito very important. We have your spontaneous breathing trials. Okay, spontaneous breathing trials or SBT. These are done prior to removal of Mech vent support. So ito, sa patient, they will attempt to breathe with minimal or no ventilator support. So sinusubukan na natin kung kaya na ba ni patient na huminga on their own kapag minimal or konti lang or walang support from the mechanical ventilator. Okay, so during SBT, okay, dito, we are watching or we are observing or monitoring the patient for signs of distress, like meron bang nagkakaroon ba ng abnormalities or changes sa kanyang vital signs? Do they show signs of difficulty of breathing? Bumababa ba ang kanilang saturation? Okay, ito yung mga imino-monitor natin if the patient is undergoing spontaneous breathing trials. Okay, and then of course, after your SBTs, okay, we have to evaluate kung successful ba yung SBT ni patient. Kaya ba niya na i-sustain yung kanyang paghinga on their own? Okay, and then of course, we have to assess the patient for extubation or kapag tatanggalin na yung tubo. Okay, assess for extubation readiness. Ano to? We have to check, okay, if effective na ba or working na ba yung muscles ng airway ni patient. Okay, we have to check if the patient has already airway protection, meron na ba siyang cough reflex, meron na ba siyang gag reflex. So these are the protective mechanisms ng respiratory system natin na ina-assess. Okay, and then if all of those are okay, si patient will be undergoing extubation or the removal of that tube that was attached or placed in the patient. Okay, that is needed for mechanical ventilator.